Honestly, I feel very conflicted about how the handling of Ebola is handled in the United States. Honestly, just from articles seen for the last couple of days and commentary, I'm just like, how do people even get away with this crap? Why aren't we prepared for Ebola on a scale? Because this is like an epidemic across the world. It can be a global epidemic. But oh no, we don't give two shits. Oh, we don't give two fucks at all. So, just an article out of Raw Story, from October 4th. The Centers for Disease Control and Prevention tried desperately on Saturday to assure an anxious American public that healthcare workers are prepared for a possible Ebola outbreak. However, most nurses on the front lines aren't so sure. Following news this week that a Texas hospital allowed an Ebola infected patient to walk out of an emergency room with a simple prescription for antibiotics. The country's largest nurses union warned that most U.S. hospitals still haven't instituted a proper preparedness policy or even educated their caregivers about how to spot the potentially fatal virus. In a strongly worded statement Friday, the NNU called on U.S. hospitals to immediately upgrade their emergency policies, citing preliminary data from a survey of almost 700 registered nurses working in 250 hospitals across 31 states. The results of the study are pessimistic, to say at least. Of the nurses surveyed, a staggering 80% said their hospital has not communicated to them any policy regarding potential admission of patients infected by Ebola. Nearly 40% said their hospital has no apparent plans to properly equip isolation rooms, and a third said their hospitals does not have sufficient supplies to treat the disease. The NNU, which said it began the survey several weeks ago, has been vocal about the imminent need for Ebola preparedness. We warned it was just a matter of time in an interconnected world that we would see Ebola in the United States, said Rose Ann DeMoro, the union's executive director, in a statement. Now, everyone should recognize that Texas is not an island either. As we have heard from nurses across the U.S., hospitals here are not ready to confront this deadly disease. Ebola has resulted in thousands of deaths across Africa. Only one patient, Thomas Eric Duncan, in Dallas, has been confirmed to have contracted the disease in the United States. Early on Saturday, Texas Health uh, Presbyterian Hospital, where Duncan was admitted, said he is in critical condition. Duncan, a citizen of Liberia, has initially visited a Dallas emergency room on September 20th, but he was released with antibiotics. In a news briefing Saturday, Tom Frieden, director of the CDC, stressed the urgency of the situation but insisted that U.S. hospitals are up to the task. We know how to stop outbreaks of Ebola, he said. In this country, we have healthcare infection control and public health systems that are tried and true and will stop before there's any widespread transmission. The NNU disagrees. The union, which released the preliminary results of its study on Friday, said Duncan's case hardly provides any assurance that most hospital staffers are trained with proper protocol. And this is the end of this article. I fully agree with the NNU on this because if this is the case, they're being very logical about this and they're being very realistic. I'm sorry. You should have been preparing this from several months ago for this kind of shit. Because you know this kind of stuff was going to happen. This is this is a disease you shouldn't be playing around with. But no, when I hear also articles where the um, the people that was living with the infected person was forced to be holed up in the apartment that's covered in bacteria and viruses and germs from that disease of that person. So the bed sheets, the furniture, everything in there is covered with the germs, the material, pretty much the stuff that can get you sick. And you're telling me that these people were forced to stay there? Oh, trust me, that's a huge fucking lawsuit that can sit there and really go through the fucking courts. Because right there, that's ignorance. That's complete ignorance and complete liability on the state of Texas on that. And especially if this thing gets out of hand and more people ends up getting sick, more people ends up getting um, pretty much infected with this disease. Oh, this is gonna Texas will definitely be sued the fuck out of for this if there is possible liability for it, because right there's a shit ton of liability issues already covered from left to right from that. And now you already I'm very certain these people who are been forced to stay in that apartment, they're very sure I'm very certain some of them are going to probably be infected with that disease, and they probably need to be quarantined at the hospital now. They probably need to go to the hospital to get treated because they are sick with it. And the thing is, it's like this article is being very realistic because when we go through art, like nearly 40% said their hospital has no apparent plans to properly equip isolation rooms. That's kind of scary, especially with such a high number. You should be seeing about 10-20%, not 40. And 80% has not communicated to them any policy regarding potential admission of patients infected by Ebola. This is how the disease will fucking spread. Because these nurses will not have any knowledge of it. When they go through the nurses training, all they have is basic knowledge. They're not gonna know right off the fucking bat of what's gonna happen with a special disease that the general public has very little knowledge of. That's why they need training. That's why they need policies and stuff structured around it. And you're telling me that 80% of the hospitals are not communicating a policy whatsoever about Ebola? Are you fucking kidding me? Maybe some of the reasons why that person probably got walked out of the hospital with antibiotics, not being sent there for further testing to see if that person had Ebola. Holy fuck! Maybe this is probably one of the hospitals, for all I fucking know. Like literally. And a third said that it does not have sufficient supplies to treat the disease. Now that I might understand a little bit more. They might not have the sufficient supplies to treat the disease. Okay, I understand the quarantine. Like I understand if they might not have the medicine or the vaccine or the treatment for it. I understand that they don't have that yet. And but when you're having a staggering numbers of 40% said they're not making any plans to put an isolation room, and an 80% saying they have not communicated a policy, that's staggering. That's very shocking, and that should be very alarming. And you know what? I'm glad that the NU is coming forward and saying something about it instead of sitting in the shadows and letting this fucking Ebola crisis go spin out of control. Because what would happen if more people got infected? Well, guess what? We're gonna have to come up with the fucking truth, and these people are coming out with the truth before it gets before shit really does hit the fan, if that's happened. Wow, I look at the situation, I look at it as a situation of Pandora's box that is cracked open. And right now we're trying to shut the box. And depending on how much strength and the strength, which the strength can be compared of how much we act towards it and how much we take preventive measures to quarantine the situation and treat the people. Well, if we do it correctly, we can shut Pandora's box. Otherwise, that Pandora's box is going to fly open, and you're going to have about a couple 100,000 people infected with Ebola in the United States. Let's just say the casualty toll will go off the fucking rails. Seriously. So, and I understand some people are trying to pull this matter into politics and try to say, "Oh my God, we should close our borders and such." Blah 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 blah. The only thing I agree with is restricting travel from that region. Fine. But we shouldn't be shutting down all the freaking borders. Oh, because you're scared of an epidemic. The fucking epidemic is going to get it to us one way or another. So what? I mean, hell, right now we have U.S. military that's over there in the Ebola-stricken areas trying to help the people there. So we don't have to really do anything, and these people we can still bring the disease back. It could be one of our own people. So stop playing the immigration card in this. This is complete bullshit. Is it you? Anyone that's trying to exploit it for immigration debates or whatever, shut up. You're just using it just to push your racist agenda. Seriously, shut up. And anyone else that's just pretty much making it into politics, it's not a politics matter. Now, if you want to look at it as the way of how the Texas government is handling it, okay, that's fine. That's all game politics right there. But if you're going to make it into issues like immigrations or any issue that really does not revolve or should not or is not really connected to it at all, shut the fuck up. Really.